Welcome back to the TradNurse podcast. Today, I have on the show Brittany, a good friend of mine. She has a background in education and a strong background in literacy. I'm going to give the mic to her to introduce herself and to direct the podcast on children's literacy. Welcome to the show, Brittany.
Hi, thank you, Christine. Thanks for having me. My name is Brittany Lovejoy, and I am a Catholic mother of 4 and recent grandmother. I'm also a dyslexia specialist and educational consultant, advocate, and tutor. So I wear a lot of different hats in the education field. I think it's important here to talk a little bit about credentials because we can say that we're an educator, but I don't know, perhaps like even in nursing school where like, okay, you're a nurse, but did you get training in this specialized area? So like literacy, even though I think all teachers should have training in how to teach literacy, including like science teachers and social studies teachers because of the different morphemes and explicit ways to teach, because we're always learning new vocabulary even as adults.
So are you saying that teachers don't get training in literacy?
I am saying that. So I'm saying yes. So our nation is experiencing a literacy crisis. Where a lot of our students are graduating being illiterate, or during school they don't have the skills to access the materials, the other content materials in courses. And this is really systemic, and I think it begins at the college level where we're not getting training in structured literacy and evidence-based practices for our students. And I think I believe like the population of people I'm maybe speaking with are nurses and Christine's friends, but I think it's really important that we know that if you think your child has a need that isn't getting met, to trust your instinct. And if you're going to meetings and they're saying everything's okay and you think it's not okay, 100% of the time, I've noticed that parents are normally right. So keep trusting that instinct. Look into every state in our nation has access to like a free parent resource center. You could ask your school who that is, and you could contact your school to get more information about how to advocate for your child. I don't know what's in Florida. I know Vermont is called the Vermont Family Network. There's one in New Hampshire, Maine. The federal government gave money because the system is so difficult to work, like to navigate for parents. So they gave money to each state to help parents navigate the system.
Wow.
So yeah, we're not just talking about like children who may or may not be needing special education. We're talking about like the whole population of students, like what kind of curriculum's happening in the school.
Do you think it's right to assume that parents assume that their children are getting literacy and that reading is being handled in the school system?
I think so. And I think what happened during COVID, when students were in their parents' home and parents were watching the instruction and watching their children struggling with reading, that parents have become more aware that there's something not right here. And what I think it is at the college level, they're still using a philosophy of education and having to train people in like learning theories that have been debunked, and they have all these standards that they need to follow, and the standards haven't caught up to to state, like one of the standards I had to recently show that I had knowledge of talked about evidence-based instruction, but it didn't say in what. So they could have had it in anything at all. But evidence-based literacy training is different, and it does take years to understand and to implement.
I know you've been studying this for a really long time, even like before AI and ChatGPT, which pretty much does everything for students now. How do you see that playing into our students just not getting what they need because they can just look everything up, typing it in a screen?
Oh,
Is it deeper? Is it deeper than that?
No, I just got a new article that I haven't read yet, but an expert talks about this. So I will give you that to post other than speaking on it because I didn't even read this article. But I think even before that moment, Christine, so you're thinking of maybe third, fourth graders who have access to researches. Some of these students still, the majority of these students cannot read independently, like
Wow.
without help. And so I think the issue is really in kindergarten, first, second grade,
Mm.
where and it's not the teachers, it's the lack of training that the teachers have had. And some of the teachers, it's still happening where they used to have students like literally look at pictures instead of teaching students phonics or phonological awareness, which are speech sounds, or morphology, which a morpheme is the basic unit of meaning in each word. Like for reporter, there's three morphemes: report-er.
Wow.
Um, and so we as specialists, we would break down these words for students, and it would be wonderful to see that instruction happening in public schools and private schools. And some schools are doing it, or sometimes they have a literacy specialist who can help students, but not all schools are doing this yet.
Right. Wow. So that's important for parents to know. I don't think they realize this. They may say, okay, my something's wrong with my son, but they may not be able to fine tune it into it's a reading or literacy issue.
Right, right. I also think that if one of the ways you could use ChatGPT possibly, or just the internet, is to look up the standards. So let's say, oh well, what are we're going to break down phonics instruction. Let's say one of your viewers has a first grader, and where do they need to be? So you can ask the classroom teacher, what 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 are you teaching? But then you can look at the state standards, and then you can check in with your child to see if they're actually learning that by let's say it's silent e words, or vowel consonant e is what we say, but just for viewers to know, like lake, cake. Words like that. So you would put a list together, and that's where ChatGPT, the parents could be like, give me a list of consonant E, vowel consonant E words or silent E words. And then you could take that list, see if your child can read it and spell it. You always want to have your child spell the word as well, because if you can spell a word, you can read a word.
Right. Wow.
And you can see if there's deficits in spelling as well. It's a really big topic, and I'm sorry that I'm unable to give you like as much information, like a whole lot of
No, this is great.
nice information, Christine.
So, like from a parent's perspective, what are some of the developmental, maybe even neurological costs when children don't become strong readers early? That affects the rest of, even psychologically, the rest of their life.
Really good. That's a great question, and it can create like it literally can create like social anxiety disorders. These students feel like a failure in school, and what happens in life, like they become obstinate in schools. I remember watching a fourth grader in library class, and I knew that she had a hard time reading, and she was sitting with her class in a circle, and as her turn to read came up, she started to misbehaving, and she had enough misbehavior that at the point where she was about to she was the second person left to read, and she got kicked out of the circle, and she had to go sit in the corner, and she was so
Right.
happy and relieved. But that behavior continues, and then students end up dropping out of school or wanting to drop out of school in elementary school because they feel ashamed. And then we can even talk about the amount of people in prison or suicidality who
Wow.
are illiterate, people in prison who are illiterate, and um, teenage
They,
pregnancies.
they can't get
There's
jobs
It's all
after.
very related. And I think it's the feeling of self-worth. Like a lot of people the the people who I've worked with who have dyslexia, they typically have like an average or sometimes even above average IQ, and they're just unable to access the material, even though they're
Right.
intellectually very capable. My
Wow.
my twins worked with a national expert, and in high school, because they entered ninth grade, one of them reading on a third grade level and another on a fifth grade level, and they ended up doing early college their senior year of high school because it's not a matter of um, This isn't a matter of students like not wanting to do the work or unable to do the work. We're actually creating we're creating additional diagnoses. We're creating like a society where
So, this is where, as a Catholic family, why literacy is a faith issue and not just an academic one, because they need the attention to pray, engage in scripture, sitting at Mass, forming moral imagination to carry them into adulthood and be successful. And so, our role as parents, literacy is.
and we have this authority over our children, and it is truly our job to educate our children. And of course, that doesn't mean you need to homeschool, but it means that we have a responsibility to monitor their learning. That brings me to another
Right.
thought. Christine and I had been talking about this very briefly, and I had to reach out to another Catholic friend. One of my friends in the school system was telling me about a particular book that she was reading with her students. And I just want to caution your readers to really be mindful and to know what your children are reading, the content, and to know that you can back out and say, for religious purposes, my child needs to have a substituted, like some substitution here, because I don't want them reading this particular book. It doesn't happen often, but every now and then, if something could be really detrimental to a child's well-being.
Well, it's all influence. You put a seed in their head through a
Mhm.
book or something that's inappropriate, and that their imagination goes there.
I want to go back to the parent's perspective developmentally. You
Mhm.
will hear teachers say that they'll catch up. That's not always how it works,
Oh,
because who
yeah.
will teach them how to catch up? So if you're in kindergarten and they're lacking kindergarten skills, can you rely on the first grade teacher to teach them kindergarten skills when she's teaching
Right.
first grade skills? So this is really the moment where you have to be very uh, aware and involved, not just aware, but very involved.
It's almost a passive aggressive way of saying, "Oh, don't worry about it." But if they're not getting the basic literacy and the basic, I don't know what the steps to reading are,
The
grammar and the phonetics, phonics, is that do they teach that?
Yeah,
Grammar, phonics, all the basics.
well, they should be. So phonics, yes, and phonics should be taught in a sequential way. So of course you have the alphabet. The alphabet, and each letter makes a sound, and you have to learn how to write the sound. So A says ah, and you're going to be teaching the student to write the letter A. Even before that, phonological awareness are the sounds the speech sounds, and that's a really important. That's in preschool and kindergarten as well, in first grade, second grade, phonological awareness, where you learn how to manipulate words without actually having to look at the word. So you could say, um, Christine, say map.
Map.
Okay. Now change the ah to I.
Meh.
Ma,
Meh.
eh, mip. It's really hard. It's no joke. I'm sorry to put you on the spot. I wasn't gonna do that. But do you see
No,
how
it
that
is
is different?
hard, but it
Because you've
those
never
are the
had
details that need to be taught to them. At what age group are they learning this? Is this
that
first grade, second,
should be
third,
kinder, kindergarten, preschool,
kindergarten?
kindergarten, preschool. Yeah.
But I
It's
don't think they're getting
amazing.
that in kindergarten and preschool. They're playing, which is okay, but
In some schools, they are. So make sure that your school has instructors who are trained in evidence-based literacy instruction. They may say it's research-based. Research-based can be anything. Anything can be researched. Evidence-based has data backing that it really does help teach. So it's evidence-based. So there's something called the science of reading, and you have evidence-based literacy instruction. There's another thing called balanced literacy, and balanced literacy is where they're like, look at the pictures. It's kind of like a philosophical approach to teaching. It's not
mm,
as strong as this evidence based. And even if your child doesn't have dyslexia or literacy needs, this type of approach works for every student. It reaches every student, where balanced literacy may have worked for a third of the students. And that's why we see like a third of kids coming, like being proficient readers in our country. And there's literally like a lot of people who are not proficient. I don't have the exact number. That's why I didn't use a data point.
Right.
Okay.
Are there workbooks parents can use to help their kids get to the right level of reading early on?
That's a really good question. Typically, if the child has dyslexia, then a parent can try, but they typically need more training. So there's books, there are workbooks. I'll give you a list so you can put it on
I'll
the
put it in the
website. I don't want to
description.
just mention one or two items
So
because
is dyslexia and literacy, are they intertwined? Like
yes, it's a great
a
question.
child who has dyslexia, will they also have literacy problems and vice versa?
N- No, so a child who has dyslexia will have literacy issues. And if you can teach a child who has dyslexia, then you can teach most any child because dyslexia is uh it is like the hardest hardest thing to teach.
Yeah, I bet. Because it's everything's backwards for them.
Well, so some directionality occurs, so the B and D reversals, but dyslexia is more like a phonological processing. So a
Okay.
dyslexic person would have had a hard time changing the sounds in the when they hear sounds
Right.
in words, and they would have a hard time spelling, and they might have an issue with their RAN, which is rapid automatic naming. So you may see a child playing and talking and just having this, looks like an average child. But then when they go to read, they have a very slow time, like sounding out each word, and it's just not coming at the speed that you might have seen a sibling happen or someone or their peers. And that's this rapid automatic naming piece. And that's where they need additional instruction or additional exposure.
Wow.
Yeah. Oh, and this can affect healthcare too, because I was uh, there's also different parts of our cognitive ability that some people with dyslexia have, like a weaker working memory. And I've noticed I just went with an elderly friend to a doctor's appointment and they gave her a memory test. And if she had had a weaker working memory, if she had dyslexia, she would have had a real hard time remembering the numbers backwards or forwards. So she might have had a misdiagnosis when in actuality she had dyslexia versus a memory loss. And one of my daughters ended up with the wrong prescription because she wasn't reading the letters properly at the eye doctors. So there's medical, yes, these pieces that it can involve.
This is also fascinating. I didn't realize how deep it goes and how much a healthy child is affected by the ability to read. So what else would you suggest for a parent that
Well, if
may not
someone's list
know if their child they're noticing something at home, but they don't know? What would they say to their teachers, or how would they? What are some paths they can navigate this?
so if they're seeing red flags, if they're seeing that they're having a hard, they're still sounding out words like laboriously in first grade, second grade, and it depends on the word. Okay, so if it's like some like perspective, and they're at the beginning of first grade, that makes sense. I'd be impressed if they could read the word. Um, but if they're spelling out words that follow a phonics pattern, and you know that they've had that instruction, then I would approach the classroom teacher who might say they're fine, or yeah, we're keeping an eye on it. If that doesn't work, the legal pieces, so this is my advocacy hat, you have to put this in writing. So you would send it to the classroom teacher and possibly the principal or the director of special education or special educator and say, I would like to request a comprehensive educational evaluation for my child because, and so you're asking the school to evaluate them for um, dyslexia or dysgraphia, which is an additional writing need, or dyscalculia, which is a um, math need. So you have to put this in writing. You can check in with that state department, the advocacy program, like the Vermont Family Network. I wish I had the name of the Florida one, but I
We'll
don't,
look
or
it up.
anyone across the country. Like there's one in every state. Check in with them. They will give you more language on how to
Okay.
advocate. I also highly recommend finding an advocate, but you don't have to. There's free advocacy sources. There's Decoding Dyslexia. There's also the board of the International Dyslexia Association. I would contact the International Dyslexia Association in your state and check in with that chapter and ask them if they have any recommendations. Sometimes there's places that offer free tutoring. I
Okay.
don't know if, or more like inexpensive tutoring. If you're going to pay for someone who has training, you're probably paying for $40 to $125 an hour, depending on the training. But the problem is this, that all teachers have, even when you get a tutor, they may not have the level of expertise that your child needs.
Right.
It's really a data piece. So if you're giving medication to people, you know exactly what they need and you know the outcome. So you as the parent need to know what your child needs and what the outcome is supposed to look like when they're receiving that service. And then you can say, oh, well, this is taking a while or this isn't actually happening because you might be hearing a lot, oh, they're making progress. Well, what type of progress? So I have a parent that a student I'm working with now, multiple students, but I'm just thinking of this one. And both parents, they're a divorced family, and both parents are saying that they're seeing progress in their daughter. They're seeing
Wow.
her read better. They're seeing her confidence go up. These are
That's
things that you would be
incredible.
looking for. They're seeing her actually take a notebook and like write a note to someone where she never would have done that before.
Are you noticing that maybe parents, yes, they don't have the ability to navigate that because they go to their parent teacher conference and that's pretty much where it ends. The teacher gives them an update on their student, and most parents don't even know what to ask. They just like, okay. And, but that's the majority of parents. Of course, there's the parents that are very on top of their child's education and they have been since the beginning, but that's not the majority of parents. They're working two jobs, both of them are working, and they probably have no idea what their children are learning. So in that sense, having an advocate or a resource, what are you seeing? Are the teachers being questioned on this? What is the role of education right now? Is there a shift more towards literacy?
There is. So there's a shift more. Emily Hanford has a series called Sold a Story, and she'll talk about the reading wars and how like balanced literacy versus evidence-based literacy and how that all came about. But you're asking like, is there a shift in a positive direction? I think the only way we're going to really get the shift is with the Sandwich approach, with leadership and parents both coming in, and really
Right.
where we're going isn't the beloved teacher, because your teacher has worked so hard to get in this position and they were not trained at the college level. It's the
Right.
colleges that need to teach these
Mm.
teachers. And I don't ever want anyone to think I'm putting down teachers, because I am a teacher and I work with teachers. And I don't know how, after they finish teaching, they have a baby or they have a family and they're teaching a whole class, which is a ton of work to begin with
Right.
until you get into the rhythm. Like, how are they supposed to go back and learn all of this? I've been studying literacy for 14 years and I'm still
Right.
learning. But if I had certain trainings during my education, which I did, I took some training at the Dyslexia Training Institute. I have some other types of literacy training that I've taken, and they've been years in the making, including practicums where I'm working with a student and a mentor.
And you
And you
also
had
knew to get your children a tutor, what or other resources are available to parents. You knew that. You
I
advocated for your children in that sense, whereas the average parent, lay parent, may not know that that's an option for
so
them.
I had to, because my happy twins in first grade would come home off the school bus, and like one of them stood by the garbage, another one was like, I'm not brushing my teeth because I don't care about myself anymore. There was like literally dark thoughts occurring with my children who were very happy and had a nostalgic childhood. They played outside all the time. They had the frog pond, and They were coming home, they were refusing to go to school. I didn't understand what was happening.
Wow.
It was traumatic, real trauma. So I pulled them from school and then I started getting the training. So now they're 20, they're actually in the education field. I'm watching what they're learning in college
That's
and
great.
I've just it's blowing my mind because none of it's really teaching them how to teach reading, how to teach children. And they're in like a school that's teaching elementary.
So they're in an elementary education program?
Yes, and a special education program as well. And the special educators normally work with students who have these really advanced needs.
Right.
So they're not getting what they need.
I know there's a
Teachers.
shortage of special educators in the state
Mhm,
of Vermont, probably all states, and
mhm.
they were providing education for students to go and get trained in special ed. Is that still the case?
That is the case, and I'm noticing the state university has this program where they're piggybacking teachers, a teacher program with a special education program, and they don't have anything else. So they have an elementary ed with special education, and they don't have them separated. So
Ooh,
I'm a little concerned about that because what are it depends on the path, but if they're expecting a classroom teacher to also be the special educator,
right,
some of these students who have dyslexia, uh, they may be in a small group with 4 students getting instruction, but they may have the RAN, a deficit in RAN, the rapid automatic naming. And
right.
so you're working with 4 students for 45 minutes, and really that student with the rapid automatic naming needs to read out loud for a good 10 minutes and needs to have explicit instruction, like individual explicit instruction, because with 4 students, that one student with dyslexia isn't getting what they need. So we're also having like a time crisis. And so with parents knowing that time and duration to get this, you can also get an educationally outside evaluation, which parents pay for with their own money, but you can get that for free by having first you request the comprehensive educational evaluation from the school, and you ask if your child has dyslexia. If they can't give you that diagnosis, which they typically don't, you can get the information back and you can disagree with their findings and request an independent educational evaluation paid for at public expense. And as part of the law that the school pays for an outside evaluator to evaluate your child. And where I'm going with this is in that evaluation, parents need to also know to ask questions like how what how often should my child be getting services? Should it be in a small group or individual? They've been getting small group services and they're not working. So can we and if you could get that written into the report, you can advocate better for your child to receive one-on-one services in the school. And these reports typically speak to evidence-based literacy instruction. So they would have to find a, an instructor in their school or outside of the school and get that training for your child. It's a huge, it's an
Wow.
undertaking. It's a lot. I was in a special education law course, COPA training, and I went to, I think I was in Boston. I went to this training in Boston, and I was listening to lawyers talk about the law and how it affected this. And one of the lawyers, who's highly respected, she said dyslexia is the hardest area because there's so many um, different things to learn about it. So you have phonics, which is the ability to, sound out cat, right? Phonological awareness, speech sounds.
Right.
Morphology, which are the basic unit of meaning within words. You have reading comprehension, reading fluency. Then you have writing and spelling, and like spelling's part of this package here, but spelling's also part of writing. And she just said it is so complicated. And she's a lawyer and she's an expert in helping people advocate. So if you feel as a parent this is complicated, it really is. It's very complex. Don't let the system with the lies that are occurring in the system confuse you. So along the way, you have the International Dyslexia Association, you have your parent network. You can contact me directly. I typically help parents for free as much as I can because of the social injustice. It's my service work for
Nice.
God because I feel like this is such an injustice for these individuals and the families. Parents spend thousands of dollars trying to get their child remediated. Make sure your child has beginning data with that tutor. The tutor gives you data, real data, not paragraphs of words, real data of where they're at. And every 6 weeks, you want to see where they're at. You want to monitor their progress.
Wow.
It's complicated, Christine. I'm sorry. I think we've been all over the
No,
place.
it's complicated, but it's also so amazing the work that you do. And I appreciate you coming on and talking about this. If parents do want to get a hold of you, could you share your contact information? And then I'll also put it in the description.
So the email I'm presently using is Brittany, BRITTANY, Laura, LAURA, the number 4 at gmail.com.
Wonderful.
And so that would be the best way, just to send me a quick email. If you don't like writing yourself, you can just send me an email with your name, say that you saw me on Christine's podcast, leave your phone, and I'll give you my phone, and we can discuss this from there. And I can help find through other resources that I know, depending on what state you're living in, I can help find resources for you as well.
That's great. That's really generous of you. And I think the takeaway is if we can get literacy right in our homes, and that will help our next generation. Thank you, Brittany. I'm going to end the podcast, but hang on.